Hi, this video is the 3.5 months follow-up, and after this we're gonna try to do once a month, right?
Oh, once a month? Okay.
Well, yeah, well, once a month, and so the audience want to know what's it look like, the recovery and those stuff. And a lot of time, I normally try to do a year follow-up, right?
Right.
But sometimes the audience say, what's it look like 2 months later, 3 months, 4 or 5 months? So we're gonna do, if you can come back once every month, that'd be great.
Right.
And so this is what he look like, and he has some great hair. So you pretty excited, buddy?
I am actually. We got this done on September 23rd,
Yeah, yeah.
and it started to fall out like what you said, Dr. Diep, and on that 3 month mark, all of a sudden it's just started to fill in because at first everything was gone here, and all of a sudden it just started to fill in, and it's got darker and darker every day, and
Now again, the audience gotta know that it take a year for it to fully grow. Okay,
Right.
so I'm gonna show the audience what he looked like before, and this is where Chris was, and again, you know how I play the video.
The before hair transplant.
But in terms of this is where he was, and front view, left, right, and that's how thin he was now. So this is where he is now, and again, it's, if you just pay attention to the follow-up months by months, and eventually in a year he gonna look so much different, and I'm excited for him, and he gonna look much younger than before, and yeah. So did you have any in terms of like when did you notice the hair start shedding for you?
it started shedding actually within a few weeks.
A few weeks, huh?
Yeah.
2 weeks to a month?
Yeah, about a few weeks to a month, it started to shed, at different rates, and then after.
Did they all fall off at the same time, or?
No, just different rates, and then and some areas fell off quicker than others, and patchy. At first, I was concerned, but realized it's just it's normal.
Yeah, and a lot of people worry about, hey, does it come out, when it come out, does it look abnormal and all stuff, but it's not really, huh?
Right.
And the transformation is slow and subtle. If you don't pay attention to your old photo, you're gonna forget how you look like before, right? But with you, Chris, you watch, you look at it every day.
Yeah, I do.
But many years gone by before you actually decide to do surgery, right?
Right. I mean,
Yeah.
it took me a couple years. I referred a friend of mine. Actually, I came and found you first, and then I told him that I was going to get this done, and he decided, hey, you know what, maybe I should too. I go, well, let me refer you. So he came in, as you remember, and actually, he had the funds first, and he was able to do it. And for my situation, the only reason I waited a couple of years longer than him is because, the financial part, I just wanted to make sure I had everything, and scheduling, and that was the only reason. And
How about the bodybuilder, the story you were telling me about?
the bodybuilder, well, I met him at a gym, and he was a cousin of a buddy of mine, and I could not tell that he had his hair done because he had so much hair. And then when I was doing my research online, and lo and behold, I come across his video, and I go, oh my God, that's the guy at the gym. And so I was like, I can't believe he got his hair done. And so the next time I saw him at the gym, I pulled him aside and we had a talk, and he's very candid about it, and he was not embarrassed or anything. He's, oh yeah, let me show you. And then he showed me, he told me everything about it, and I inspected his hair, and he looked at mine. He said, look, if you want your hair done, Dr. Diep will fill your hair up like a mop if you wanted to. So, I was sold. And again, the other reason I was sold is because when I was doing my research online, a lot of people like to see before and after photos and videos, and Dr. Diep by far had the most, before and after, because that's real people, and it's like a person like me sitting here, a patient like me sitting here, and it's real time, and other videos you see, it looks very cosmetic, like, the lighting was cosmetic, and, the music, they edited it, but this here, his video was raw, so I knew.
I don't know what you edited.
Yeah, everything is raw, so I knew, the results were real, and this is what you're seeing, and then I made an appointment to come in, and the rest is history.
Well, my filming skill is not the best. Let a lot to be desired, but my surgical skill is different,
Right.
and I promise you that. But this is where Chris was, and again, this is a 3.5 months, and we're gonna do a 4 or 5 months, and we're going to continue until a year. And the audience, just please follow his next video. Thank you.